Erectile dysfunction. All the guys' ears just perked right up. It's like, okay, don't like talking about it, but it's true. Erectile dysfunction ends up affecting a lot of people. As a matter of fact, about half of men between the ages of 40 and 70, they expect to have some sort of erectile dysfunction. And how's this? Oh, COVID, it's no big deal. Oh, you'll be fine. Turns out that studies are finding that COVID could have a connection to ED and new cases of ED. If you are suffering from ED, you want to be able to get it taken care of once and for all, but you're not looking necessarily forward to going under the knife or getting any things jabbed into you. Our next guest has exactly the information you want to hear.
He's coming to us from Salt Lake City just now. Andrew Reinhardt, medical technician with Boost Medical. Andrew, welcome back to the show. We know that you go about treating ED in a very different way. Tell us how you go about it and why you think it's better than the other treatments that are available out there.
Yes, great questions. And to this day, I am yet to meet a man that wants to take the pill or to those nasty injections. We want on-demand function. We want something that works. Well, that is where Boost Medical Clinic comes in. We use acoustic wave therapy. This is FDA registered and clinically proven to open up and regrow blood vessels. We can't forget erectile dysfunction is a blood flow problem. That's what we're treating. So we're getting guys and couples back to normal function in the bedroom. And like you guys said, no pills, no injections, no surgery. This is treating the root cause of the problem.
Yeah, no question about it. I know obviously the problem is something that the man lives with, but whoever lives with the man, it's going to be a problem for them as well. And it seems as though COVID could have some sort of connection to possibly having some rise in new cases.
Yeah, absolutely. We've heard that if you get COVID, you have a better chance of getting erectile dysfunction. And even if you don't get COVID, if you're experiencing the quarantine and spending more time with your significant other, maybe that kind of puts a magnifying glass on erectile dysfunction.
Yeah.
So we want to get this fixed and get you back to those younger years.
Yeah, definitely. And I know in previous segments we've mentioned spontaneity, and a little spontaneity really goes a long way. I think, so many of us know that. So you're helping people find that again. Let's talk about a little bit about the science, because if this issue were affecting me or someone in my family, I would want to know that it was safe. So what kind of studies have been done?
Yes, great question. Extensive studies have been done. The science page at boostmedicalclinic.com has 42 clinical studies, and we add every month to that, by the way. All of those studies basically conclude the same thing. This really can regrow blood vessels. It really can reverse erectile dysfunction. Cambridge University, one of the studies, at the end of it, they said all men experienced an increase in blood flow. So we know the science is sound. We've treated thousands of guys all over the country. And by the way, the studies, they tested younger guys, older guys with every kind of health condition. The success rate is very high.
Which is pretty amazing. What are your patients been saying?
Well, we love to get feedback from the patients. We had a 77-year-old gentleman comes to mind. He was able to get off of the pill and injections after having erectile dysfunction for 10 years. This is a breath of fresh air.
Mm-hmm.
It typically only takes a few treatments. They're 10 minutes. So the feedback has been incredible.
In fact, we're going to hear from one of your actual patients, Andrew, right now. Her name is Pam. Sean, what did she have to say?
And it's worth noting, by the way, she's not the patient, but she's certainly benefited from the patient being her husband. My husband completed treatments after struggling with ED for many years. We're so relieved that he doesn't have to take the pill any longer. The treatments were fast, easy, and pain-free. Really, I mean, this is not just benefiting the person that the treatment's being done on, but frankly, whoever he ends up being with as well.
Yeah, I love that so much because we get great feedback from the men. Let's not forget erectile dysfunction affects two people. There you heard from Pam. She seems to be enjoying the results also. So at the end of the day, Boost Medical Clinic improves relationships by eliminating the ED.
Excellent. And Andrew, you have a special offer today for men who want to start the new year on a different foot. What is that?
Yes, we do. When it comes to erectile dysfunction, men often do nothing at all, and the problem gets worse. Well, call us now if you are struggling with ED and sick of those pills. We are giving away a lot for free today. The assessment, the exam, even the blood flow ultrasound with our doctor, no charge. We'll also throw in a little special gift that I think you'll really enjoy. It produces instant results in the bedroom. Now, all of this is totally free to those that call us right now.
Awesome. It's great having you, my friend. Thank you for joining us.
Thank you.
All right, take advantage of that special offer through Boost Medical Clinic. Their number, their website, right there on your screen. Boost Medical Clinic, a proud sponsor of the Morning Blend.